My interest in science began when I was at high school. I remember I select all science subjects and I quite enjoyed doing science experiment in the class. My first exposure to research was when I was at my final year of undergraduate degree. I got involved in helping to conduct a clinical study at the Centre for Eye Research Australia. That's where I get inspiration to do further research, particularly in eye research. So when I finished my PhD, I decided I need to go overseas to do my postdoctoral fellowship to get more research experience. So at that time I have two choices, whether to go to the US or to Singapore, and I ended up to Singapore just because it's much closer to Australia. So I worked at the Singapore Eye Research Institute for 7 years, and then I moved back here to Melbourne in 2008. And since then, I work at the Centre for Eye Research Australia in the Macular Research Unit, which is headed by Professor Guymer. I have many hobbies, but my top two are playing badminton and flying aeroplane, on simulation that is. I like flying simulation because it's quite challenging and exciting, and it took me years to master. And I feel the same challenging and excitement in my research. The title of my research project is the Static and Dynamic Retinal Function Topography in early stages of age-related macular degeneration. This research will be undertaken by me and my co-investigator, Professor Guymer. It will allow us not only to identify individual patients who are at risk of losing the vision, but also enable clinical trials on new treatment to be conducted more quickly. Currently, there is a lack of clinical tests that will allow us to test the efficacy of new treatment quickly, and I believe that this new technology will help us to achieve that. Macular Disease Foundation Australia has many important roles, including providing awareness to the general public, providing education to the macular disease community, and research support to our clinicians and scientists. And I'm very privileged and honoured to have this opportunity to work with the foundation to work towards our common goals, that is to reduce the impact of macular disease in Australia and globally.